In the medical field, there has been many changes in the way that doctors and patients communicate and act with each other. In life, people have different beliefs and values. These values shape what they are comfortable with and what choices they make. For this reason, a patient's values has an important role in what treatments they are comfortable in receiving. The word autonomy means an individual has the right to choose what treatment they receive. In your cases, as teenagers, your guardians have control over your medical choices in order to help make the most thorough choice based on the information provided by doctors and personal moral values. Throughout history, how doctors and patients interacted with one another has significantly changed and been outlined in different models. The main four components of these models include the goals of the interaction, physicians' obligations as doctors, patients' values, and the idea of patient autonomy, which is the right to choose. When medicine and doctors were starting long ago before World War II, doctors were often familiar with their patients and went to their home for visits. During this time, the doctor-patient relationship followed a paternalistic model. In a paternalistic model, the doctors diagnosed the patient, determined and informed the patient on what they believed was the best course of action, and waited for the patient to give consent to that treatment. The model allowed the doctors to ultimately make the choice of which treatment they viewed as best, without considering the patient's values. The doctors acted as guardians or parent figures, and the patient's values don't have a role in the choice of treatment, just simply giving consent. Another model emerged known as the informative model. In this model, a doctor is expected to inform the patient on different treatment options, risks, and benefits in a factual manner. In this model, the doctor does not give any recommendations, and the patient makes the choice based on their own values and information provided. Models continue to develop as expectations for doctors' roles changed, leading to the model that is currently most supported called the deliberate model. This model believes that doctors should give patients information and help the patient choose which values and treatment options are best. This model believes doctors should have conversations with their patients and suggest why certain relevant values are important. This does not mean that the doctor argues with the patient, but instead gives recommendation and discusses relevant values and ideas that may have not been considered. The patient, or for you guys, guardian of the patient, gets the final say in which treatment is done. Overall, the idea of what a doctor-patient relationship has changed a lot since the beginning of medicine, ranging from doctors making treatment choices, patients making choices without doctor recommendations, and open discussions regarding different values and options. Doctors are meant to help patients, so changes in how they interact is very important when trying to make these relationships as meaningful and beneficial to patients as possible. As teenagers, you guys might not think about the interactions you have with your doctors, but it's important that in the future you understand you have the right to make these choices based on your own values, and that different interactions and deliberations you have with your doctor is a result of these changing relationships.